Moms and dads, this is Dr. Scott Haggerty. And for those of you that were trying to log on before, I apologize. We had some technical difficulties. So thank you for hanging in there. And I see that there's quite a few that are popping on. So if you have questions as we go through tonight, feel free to put them into the chat box. And I will make a point of trying to get back to everybody about their questions. So as we get into tonight's webinar, moms and dads, if you guys are here, obviously it's because you are probably dealing with a child, a loved one, or somebody in your family that is struggling mightily with your infection. So tonight is going to be about resources. Tonight is going to be about why they're getting them and how we can start changing that so that they will no longer have to live with constant ear infections, one after the other after the other. Because moms and dads, listen, I understand, right? Like, it's terrible, the idea of your child going through this continuous perpetual cycle. I mean, how awful is it every time that your child has an ear infection and they're screaming and they're crying and they're miserable and you don't know what to do to help them? You know, you're taking them to the doctor time after time after time, and you're going on this constant cycle of using multiple doses of antibiotics and emergency room visits and continuous pediatrician visits. And you're dealing with the fevers and the sleepless nights for both them and for you. And the worst thing in the world is to see your little one laying there sick, uncomfortable, miserable, and you feel like there's nothing that you can do to help them. You feel completely and totally helpless. And of course, I know that, if you've been going through the cycle, then there's frustration, probably wanting a different approach, saying, this isn't working. What are we going to do? We get a lot of kids that come in here where they've already gone down the road of getting tubes, and oftentimes that may not even necessarily fix the issue. And so it's frustrating because it's this continuous cycle of one thing after the other, searching and seeking for answers. And I know many of you are trying to get out of the cycle of the repetitive ear infections, maybe trying to avoid ear tubes, wanting to know what you can actually do so that you can break the cycle. And listen, moms and dads, ear infections are a really common thing, way more than we would ever like to see them. But just because they're common doesn't make them normal, right? I mean, here's some basic stats. In the United States, over 80% of all children will experience their first ear infection by the time they are 3 years old. 80%. In the US, ear infections account for more than 30 million visits to the pediatrician per year. Some children experience not just one, not just two, but 6, 7, 8, 9, 10, 12, 15 ear infections before they get any relief. And what are your primary things that you're left with, right? Multiple times of using antibiotics, tubes. I mean, moms and dads, this isn't working, right? Like, the same cycle over and over and over again of putting this in. Something is not working. You're not getting to the root cause. Although ear infections affect such a large group of children, they're very common, but not normal for children to experience them. There are many children, many that we have here in our practice on a regular basis, that never ever experience them. And listen, I know many of you have been given the story, right? Like, that it's the orientation of their ear tubes, they're horizontal, and they're not angled downwards. But that's not true. There are so many children that I care for that I've had since birth that have never gotten an ear infection. If the orientation of the inner ear were the main driver of why kids do or don't get ear infections, that every kid would get ear infections, but that's not the way that it works. What you have to understand, there's more at play, right? Like, the ear was actually built to drain. So if you're not aware, there are two primary types of ear infections. The first one is called otitis media. That's your middle ear infection. That's the one that's considered to be the most common. When you go in, the tympanic membrane, the eardrum is really swollen, pus on the backside of it. That's an inner ear infection. The other one's called otitis externa, which is your external ear infection. That's the one that most people, if you've ever heard of swimmer's ear, that is typically what we're referring to when we talk about swimmer's ear. So, interesting thing that I think a lot of people, and most of the parents I talk to have never really been told, is that the vast majority of ear infections are viral in nature, well more than 80%. Here's the thing, right? And I ask this question, and you should be asking this question too. When your child presents with an ear infection, the very first thing that you say is, I want this cultured. Because Per the American Academy of Pediatrics, they know that over 80% of ear infections are viral in nature. If you give a child with a viral ear infection antibiotics, it's not going to kill the infection. Antibiotics are only built to attack that bacteria. They have no ability to affect viruses whatsoever. So if you give your child antibiotics and they actually have a viral infection, then what you do is you predispose that child to potential for antibiotic resistance. And there's other harmful effects like potentially allergic reactions. It messes with their gut flora, potentially making them open to secondary infections. There's all kinds of different things. And one thing you have to keep in mind is that there's research studies that show out there that children that have multiple bouts of antibiotics by their 6th birthday have an 80% increase in their lifelong likelihood for developing asthma. There's a strong, strict correlation between those two. And 50% of kids present with fever. So that's not a strong indicator one side or the other. That's why if you go to the doctor and your child has an ear infection, first thing you say is, I want it cultured. And what you should be hearing is the best thing to do is watchful waiting. Manage it. There's a lot of natural things that can be done, but oftentimes I know that's not really something that many people are schooled on unless you work in the natural realms, nutrition, chiropractic, naturopathy, homeopathy, where there's a lot of natural remedies that can be given. But if you try and put in an antibiotic on a viral infection, you potentially make it worse because you weaken the child. That's why if you've had a child that's gone down the road multiple times with an ear infection, and it seems like it gets a little bit better, but then it comes back and it gets better, and it comes back and it ebbs and flows over and over again. What you're dealing with is a viral infection that you're putting an antibiotic on. And so until their body naturally fights it off, it's going to sit there and it's going to fester. And, there are things that we know that are common signs and common correlations to when children are most predisposed to start getting these things, because it's when the immune system oftentimes tends to be most challenged. So we tend to see a lot of kids when they start teething, they tend to have a pretty significant correlation to timing. They tend to present with a lot of congestion. They tend to see a lot of fluid. You tend to see your child pulling and tugging on their ears. And it all kind of comes in sequence. Here's a couple of things to remember, right? The way that this happens, it's not that the fluid gets stuck and then you get the ear infection. It's that if the fluid stops moving, they are susceptible to get an ear infection. The goal very simply is to keep the fluid moving. Because, here's the thing, mom and dads. We know that there is a sequence of events that happens when children go down the road of having multiple ear infections. And here's the way that it works, right? Once a child starts getting fluid in their ears, if they can't get the fluid moving, then what's going to happen is that your choices start to go down a very particular pathway. Once that child has that first ear infection, if they get multiple ear infections and they're going through and doing the exam and they're noticing that that child also has enlarged tonsils, they also have large adenoids, start seeing issues with snoring and sore throats, what's going to happen is that they're likely going to be looking at first and foremost ear tubes. Right. And, mom said it's surgery. It's your little one having a surgery that I know none of us want our little ones to have, because it means anesthetic, it means pain, it means recovery, but it also doesn't necessarily always fix the equation. We get a lot of kids who come in here who had multiple ear infections, even with having ear tubes, because it was a Band-Aid. It never really got to the cause of the root problem. And so, dealing with that, and then what comes next is that you see a child's immune system never really is defeating the infection. So it gets it sick over and over and over again. That's why we start getting the tonsils getting enlarged and the adenoids getting enlarged. And then what comes next? Once they're enlarged and they stay enlarged, then they get removed. So you've had 2 surgeries. And now you're looking at, your child dealing with then the fluid that should have been going here. Well, now you've poked a hole in the eardrum. So all of that infection now is making its way downhill. And if it doesn't have the tonsils to stop it, the next place it lands in is the lungs. And then you start seeing lower respiratory tract infections, lung infections, and because of the multiple doses of antibiotics, an increased risk for asthma. Moms and dads, let me ask you a question. If you knew that this was the sequence of events and you knew that all of these things can potentially increase your child's likelihood of developing asthma, and that your child's never really getting past this infection and it sets them up for a weaker immune system down the road, would you make these same choices if you knew that there were alternative ways that are more effective that actually get to the cause? Right. I think it's an easy question, right? Like we all know that if there's another way, that we're going to choose that other way. But I think many of us oftentimes don't even really realize where these problems start, right? And I think it's important that we talk about this because there's so many commonalities in the kids that we come in that get repetitive chronic ear infections. And here's just some of the basic factors. We know that the labor and delivery process is intimately involved in the vast majority of our kids that come in with ear infections developing them. Because very typically we tend to see that there was a very intense labor and delivery process, oftentimes prolonged, oftentimes with interventions. Once they're born, we start seeing warning signs, right? Like start seeing issues with like nursing issues. We tend to see their side preference. We tend to see that they tend to favor one side versus the other, so they're not having a lot of range of motion. Oftentimes there might even be things like a torticollis present. And if you don't know what a torticollis is, this is what that looks like. Your child's stuck in this position. And you're oftentimes told, well, go to PT and they're going to stretch the muscles. And if you've ever done that, it's brutal. Like your child will oftentimes scream the entire time because what they're doing is, and then this is perspective for you guys. When your child has that torticollis, it's not a muscular issue. No muscle in the body works without a nerve telling it to work to protect something. So if you've ever had a stiff neck, okay, like headaches, stiff neck, threw your neck out, something like that, your child is dealing with a side effect of labor delivery or even potentially position while in utero that has caused their neck to go into a protective mode because the spine itself was affected. And in turn, when a child has a torticollis, there was effect right at the brainstem. And so the brain is then triggering muscles to spasm to protect it. So they're stuck in this position to try and protect the brainstem area. And the thing of it is, if you go in and stretch it, you might make these muscles longer, but that issue's still there. And so you'll notice that the range of motion, even in kids that we get in that come in years after having had therapy for the torticollis, they'll still have the curve because all they did was loosen the muscle. They never affected the neck. And so the problem that was there in the beginning is still there. The problem that was there in the beginning is still there. Sorry about Sarah. She's got a mind of her own these days. And so you'll see that it's still there. And so the problem with the mechanics, the neuromechanics of the neck, even though you stretch the muscle out and it's longer, it's still having other effects that oftentimes we don't realize. And, many of you probably have had this effect before, right? Like if you get a headache, you know what I'm talking about, where you can't turn your head very well and you feel really stiff and, you've got this tightness and the muscles in your neck, they feel like they're in a vice and your head feels really heavy. But there's other things that comes with it sometimes too, like the pressure that oftentimes you get by the sinuses and behind the eyes, right? Or, you might feel like, you've got pressure that's going into your ears and you're not draining really well, the quote unquote sinus headaches and all that stuff. Well, what you're getting is the exact same thing that your baby does. Drainage is built so that from the beginning of life through the end of life, we have one simple mechanism on how the neck is built to drain. So your hard palate, right, up inside your mouth, the hard palate is an anchor for a muscle that goes from the hard palate over to the eustachian tube. And that muscle is built so that every time that we open and close, we suckle, we move, it's constantly pulling on the inner ear to go and pull fluid via a vacuum effect from the sinuses here and here, from the inner ears, so that we can get it out of the cranium and then swallow it, get into the stomach so it can be dissolved in stomach acid. One of the things that I think it's really important to realize is that this process is a neuromechanical process. When the neck moves the way that it is supposed to, right, then what it does is it also allows for normal conduction of nerve impulses to that muscle. When the neck stops moving, a term that we use in chiropractic called a subluxation, it's almost like having a breaker in your house go. The nerves that are associating with the inner ear and the eustachian tube, if that top of the neck, the brainstem goes, it also decreases the function of those nerves because it's an input-output relationship, and loss of motion essentially affects that relationship where the impulses can't make their way back and forth the way they're supposed to. Imagine like a dimmer switch. If the light should be at 100%, but you turn it to 50%, only part of the information is getting in back and forth, then the function of the nerve is not going to work as well as it should. So the ability of the inner ear to be drained by traction on the muscle is not going to work at capacity either. So you're more likely to retain fluid. So now you're starting to get the process of building up fluid in the inner ear because the ability of the brain to go and pull it out using the mechanics isn't working like it should. But here's something to keep in mind, right? You've probably all experienced this. Like if you've ever been on an airplane and you yawn or you chew gum, what you're doing is you're stimulating that process. Well, if a baby cannot do that, right? And suckling isn't working, and moving isn't working, and they're not getting this mechanical process, then fluid will start to build up in their ears. And so, what ends up happening then is that all of this stuff, right, that's loss of motion, creates this complex where every time your baby goes through this process, it's creating stress inside your baby, right? Because think about it, like pain, illness is a stressor for you. Well, every time that your baby goes through that, they're also going through stress. And so it starts to evolve in other things, right? It starts to evolve into things like, it turns into gas, and it turns into a baby that's constantly uncomfortable. And you start seeing that, your baby's not sleeping very well at night. And it oftentimes is something that, when we ask questions about why is this happening, they'll grow out of it. But what happens is they don't typically grow out of it. It just evolves into something new. Because like we talked about, that early ear infection can turn into things like chronic strep and having the tonsils taken out. And it can evolve into bronchitis, and can evolve into asthma. And it's something that started as early as that inner ear infection that translates into things later on down the road, because we never got to the root cause. Because what's happening is that this baby's stuck on the stress mode on gas pedal because of processes that happened right in the very beginning. And what it does is it progressively weakens that child's nervous system and immune system, because when you're in stress mode, here's a really important term: you can't be in growth and protection at the same time. And when a child's dealing with the constant stress of the immune system, and you've got the stress that's being created by the loss of motion of the neck, then that subluxation will constantly feed itself, meaning that the nervous system is constantly in overdrive. And what it does, it weakens the brain's ability to turn on the part of the brain that controls growth and development called the parasympathetic nervous system. The parasympathetics are really important in this equation because they control all immune function. All immune function. The ability of the body to drain the ears and the ability of the body to fight viruses, bacteria, all things that we're going to be infected by are regulated by the parasympathetic nervous system. While the repetitive antibiotics, the mechanical, neuromechanical stress of the neck dysfunction, the stress of being sick, the pain of being sick, all of that stuff weakens the baby's defenses, so it predisposes them to go down the cycle over and over and over and over again. I want to share with you a story. So we got this sweet little girl. Her name's Heidi. And when Heidi started in care with us, so Heidi is 8 years old. And when we first met Heidi had already had ear tubes, and she had been dealing with multiple bouts of ear infections. When we went through her records, she had had a grand total of 15 recorded and probably more ear infections. And mom's a nurse, so mom had literally tried everything there was and was becoming progressively more frustrated because the ear tubes weren't even doing the deal. When she came in, Heidi was going down to the nurse's office at her school weekly, complaining of ear pain. And this isn't a girl who's like the kind of girl who's going to try and get out of school. She's a good student. She gets straight A's. She doesn't like to miss class, but she was dealing with just chronic ongoing ear pain. And so when we talked to mom in the very beginning, we talked about this exact process. She had a very complicated labor and delivery, lots of interventions. It was really rough in the beginning, and she had all the things that we talked about. And when we talked about the way that the system, the nervous system works, how it neuromechanically controls drainage, it was like an aha moment. Because once you put in perspective that the effect of the birth process that it actually had on her baby's ability, like her little girl's ability to drain her inner ears, was a direct byproduct of the stress of labor and delivery, and it blew the breaker system. And so all this stuff that she had gone through for the first 8 years of her life, it was all things that were massive stressors for her. So her immune system was weak. Her nervous system wasn't recovering. She was having a ton of difficulty with this because it was affecting everything that you can ask for in quality of life. It was affecting her ability to learn to hear, to speak. She was delayed. It was affecting her ability to, function at school because of the pain. It was affecting her, her desire to go out and be social. It was affecting so many areas of her life, and mom was completely frustrated. And ironically, my wife had talked to her at a birthday party a while back. And she said, we deal with this all the time. There's lots of kids that we care for that come in with ear infections. Give it a try. And so at wit's end, after her daughter had been going down to the nurse's office at school every week, complaining about the ear pain, she said, I've got to do something different. And she called our office, and we had her come in for an evaluation. We did a physical exam. We did neuroscans, which help us to understand exactly what's going on with her nervous system at a very deep level, right? Understanding where these drainage issues are. If we see these things on the neuroscans, they tell us that we can or cannot help. And we saw exactly what we needed to. The brainstem area was lit up like a Christmas tree on the scans. And we saw that there was some significant effects in the physical exam, loss of range of motion, some retained curves that she had. And so we knew with certainty that her neck was the primary driver of her ear infections. And so when we started her into care, we began a protocol of adjusting her a few times per week. And we set her care plan out over the course of a few months to give ourselves enough time to break the cycle that she'd been in, but also to get her neck to learn how to go and keep the motion and essentially keeping the breakers on to keep the ear draining the way that it's supposed to. And it was interesting. Within the first month, she went from having ear pain almost constantly going to the nurse's office to not having one time after her first week that she had to go down to the nurse's office. Now, 3 months into care, she hasn't been to the nurse's office or had any ear pain since. So it's been a really dramatic improvement in this little girl's quality of life and her family's quality of life because, mom's nurse was frustrated because she tried everything within the system and nothing was getting better. Her little girl's quality of life is tremendously better because, number one, she's hearing better. So she's not dealing with pain. She's not dealing with the frustration. Her immune system is getting stronger. In the first month, she went through this thing we call a detox, neurobehavioral detox. When we start doing the adjustments, it helps her immune system to reboot, to begin to actually fight off the infections that were retained. So she drained out a bunch. Her first couple of weeks, it was a lot of drainage from the inner ears and the sinuses, spiked a little bit of a fever. And, I told her mom, and I tell everybody this, she's not getting sick, she's getting well for the first time. Because what happened is within a matter of a few weeks, her tonsils began to calm down, get smaller. Her immune system went through this phase where she spiked a bit of a fever and a lot of drainage, but once it ceased after about 2.5 weeks, it was gone. And since that point in time, she's not had any issues at all with ear pain, any issues at all with drainage. And now she's essentially dealing with normal levels of drainage, no ear pain, sleeping well, hearing well, and her quality of life is entirely different. If that was your child, and I'm sure many of you deal with that, what would you be feeling? What would you be thinking? Like, how would that affect your quality of life? Because when I talk to Heidi's mom, she's all smiles because the effect it had on their family's quality of life was terrible because they were always worried about her getting another ear infection and all of the things that she missed out on because of those ear infections and the sleepless nights that they had all had. And, the suffering that they watched their little girl go through and just the constant pain. Moms and dads, I know that if you're looking for solutions, you're trying to figure out if this is something that can help you. And I get it. I know that many of you are really looking towards what can I do to help? And I will tell you that if you've never investigated chiropractic care allows for better drainage. By getting adjusted, it helps to go and stimulate the movement of the fluids because it turns on that process that we talked about. It boosts the immune response because it re-engages your child's parasympathetic nervous system or yours if you deal with this stuff. The single most important thing that you can do if you have a child that is dealing with recurrent ear infections is get them checked. You literally have nothing to lose but some time. And listen, even, because we care so much about this, we're gonna lower the barrier. What we do as a part of this process with these webinars, because you took the time to attend, is we are going to reduce the cost for our regular fee so that you can get this information as well. So because of attending, each one of you that were here for this webinar today, we are going to take our standard fee of $175 and we're going to reduce it to $47. The same fee, the same thing that when our existing patients refer their friends, that's the price that we give them. So because you're here, because you took the time to be a part of this, we're going to do the exact same thing for you. So when we get done with the webinar today, what I want you to do is I want you to go to www.elitefamilychiros.com, go there and request an appointment or call us directly. I know many of you are probably finding some urgency. I need to get this information. I need to get my kid checked so I can get this information. You can also call the office at 440-230-2300. And what we'll do is we'll set up for you a phone consult so we can talk about your child's history. Get the nitty-gritty on what you guys have been through because it's a super important piece of helping myself, Dr. Brandon, Dr. Lena, our doctor team to effectively understand what is going on and how to help. We'll schedule a physical exam where we'll come in, we will go through and evaluate your child's spine and nervous system. And then we'll also do a set of neuroscans. And neuroscans, they're amazing because they're a 360 degree of what is happening inside of your child's nervous system when they come in. And it gives us a very clear picture of where they are, but also where we need them to go. So once we complete that, then what we'll do is we will then have what's called a doctor's report of findings. Doctor's report of findings is where we lay out for you care plan recommendations so that we know what we need to do to get your child past these ear infections once and for good. Now, moms and dads, I have to tell you, I'm super excited about something, because one of the things that we really care about doing is creating healthy, happy kids, healthy, happy families, restoring quality of life. But one of the big things that this will do is, when you become a part of this project, this year we are engaging in one of the biggest, most significant initiatives in pediatric history. Our patients, your data, when you get your neuroscans, is going to be contributed into this massive research project to help children who deal with ear infections, that help children who deal with sensory processing and ADHD and ADD and autism. All of the data that we're going to be gathering from those neuroscans is going to be contributed into this large-scale research project, where we're taking millions of these neuroscans through AI into a PhD research group in New Zealand to help to go and benefit improving quality of care for kids across the world by getting the research done, getting the research out there, so that kids like we see here in our practice, so that kids all over the world can have access to the kind of quality care that our kids get here. So moms and dads, I know that many of you are probably anxious to go and get your child started. So when we get off here, I want you to go and make that move. If you are wondering a little bit more about if this is something that could be right for your child, call the office, call the front desk, talk to my staff. And what we can do is we can set up a 10-minute consult where we can just sit and talk and find out if this would be the right thing for your child and for your family. But if you're ready to take action today, you want to pull the trigger and you want to get that exam scheduled, then when we get done here, once we end the webinar, just again, go to elitefamilychiros.com or call the office immediately at 440-230-2300 so we can get your child set up for their initial exam, get their history and consult taken care of, and get them on the road to getting past this. Because moms and dads, the most important thing that we can do as parents is get the answers, get our child on the road to health, and take the steps necessary to get them off this perpetual cycle of chronic ear infections. Moms and dads, I am so looking forward to meeting each and every one of you. I thank you so much for your time today. And I'm excited to get a chance for us to work together to get your child and your family living the quality of life that you all deserve. So this is Dr. Scott Haggerty with Elite Family Chiropractic. Thank you so much for being here with us. And I look forward to meeting each and every one of you here very soon. God bless you guys. Be elite.